Good morning, Lake Providence Church family and friends. Thank you for joining me today. This is Dr. Linda Plummer Ward, and we're here with another health ministry update. So glad that you were able to join us for our webinar on yesterday on breast cancer. If you weren't, check it out on the LPMBC Nashville Health Facebook page. You know, the pandemic continues with no end in sight. Let's just have a wonderful attitude of gratitude. So much so that we forget about all of the bad things that are going on around us. So much so that we can smile and inspire someone else. So much so that the love of Christ just flows from us because we are concentrating on Him and His love for us and how He has continued to keep us through this whole thing. You know, the number of cases continues to go up, and not just here in Nashville and Davidson County, but in Tennessee and across the United States. And not even just in the United States, but around the world. We're seeing a second surge. We haven't seen numbers like this in the United States since July, especially here in Nashville. The wonderful thing about this, even though we're seeing more and more cases right now, is that the number of deaths is not increasing. And that's a good thing, but we don't quite understand why. We think maybe it's because of the increased awareness of COVID-19. Maybe it's because of the testing that we have available and the contact tracing that goes along with that. All of those things provide for earlier treatment. Maybe it's because of the new and standardized protocols in the hospitals and intensive care units that allow us to take care of these patients better. Maybe it's because the masks we wear are actually reducing the severity of illness because it limits the amount of virus that we actually inhale when we're exposed. That will also limit the deaths. We don't have a vaccine for COVID-19, and we're not going to have one anytime soon. People are working feverishly to come up with one. And when we do come up with one, it should be FDA approved without any outside influence. We do have a flu vaccine, and it's strongly encouraged that we all take the flu vaccine. I've had mine, and it takes about 2 weeks to build up antibodies. October is the month when flu season will start. And we don't want both of those viruses affecting our lungs at the same time. We also don't want both those viruses affecting our healthcare system. We want to be able to take care of everybody in an equitable manner with good resources and plenty of nurses and doctors to take care of them. I don't know what's going to happen with this. All I know is God is still in control, and I have to put my faith and trust in Him, and so do you. This is our time to put our hands in His hand and let Him wrap His arms around us and continue to keep us. As always, I encourage you to be safe, be healthy, and stay prayed up. But especially now, not just for yourself, but your family, your friends, and all you know. Help them understand the importance of this and how we can help each other. I hope you have a blessed week. Thanks so much for joining. Take care.